Well, healthcare issues actually began when I was member of the House of Delegates in the state legislature of Maryland, and I chaired the subcommittee on health policy. And so that was really my introduction into health issues. When I left the legislature, I carried that on as being on the board of a hospital and other community health organizations. And then when this popped up with the Immune Deficiency Foundation, I was really gratified to be able to work with patients and work with policy issues. IDF is the national patient organizations for people who have a primary immunodeficiency disease. Many just are not able to generate antibodies, do not have the cells, B cells or T cells, to generate antibodies to fight off infections. There's been a push for biosimilars probably for the last 10 years or so. As biologics have become more popular, then the cost of those drugs have been pretty high. That's really the main point for having biosimilars is to try to create cheaper drugs. Biosimilars are different from biological products. The similarities are that they're supposed to work the same way on a patient as the reference product. The differences, though, are in the nature of the DNA structure. Because they cannot be identical, the concerns are that whether or not patients will react the same to a biological product, reference product, as a biosimilar product. Biosimilars have a different approval process than biologic products. That process was dictated by Congress in 2009 as part of the Biologics Price Competition Innovations Act, whereby the process could be expedited for biosimilars. The patient community is concerned about biosimilars because of the expedited process that they have. It's not as extensive approval process that regular biologics have. And because of that, we want to make sure that patient safety and not price and not cost of drugs is driving the policies in that approval process. Patients for Biologics Safety and Access was created, or PBSA, and to help make sure that in these debates on policy issues within the FDA, that patient's voice will be heard, and that's really the purpose for PBSA. If a patient who is stabilized on a particular biological product is switched for other than a medical reason, we don't know what the effect will be on a patient. We just don't have that experience yet. They have the most at risk in this entire process, and that is why we demand that patients be a part of the dialogue and that patient safety be the driver of this train. The data the FDA has suggested this advisory has raised some questions that should probably be answered. We tell policymakers all the time that the medical professionals, the providers, are in the best position to know what is best for their patients. Patients really do need to pay attention to the issues relating to biosimilars. They need to become active. They need to be active through maybe their own patient organization, if not that, through PBSA. Patients need to raise their hand. They need to tell policymakers, wherever they may come in contact with them, they need to raise their hand and say, hey, think about patients. Think about patient safety. That is what needs to be the criteria for approval of any of these biosimilar drugs. My favorite part of working with IDF is really good. It's an extension of what I did when I was an elected official, and I get to help people and advocate on their behalf in the policy world, which I just I love to reside, and that's fun to me. It's not work; it's fun.